In our last video, we discussed 10 food that a diabetes patient should never eat. But you see, it is important that we also discuss things that a diabetes patient should do every day. Hi everyone, this is AY the Diabetes Doctor. I'm a doctor and a specialist in diabetes. Today, we are going to discuss 10 things that a diabetes patient should do to ensure that he lives a healthy life and prevent complications. Let's go ahead. We will begin by eating healthy. You will notice that I have done a lot of videos on how a diabetes patient can eat healthy. This is extremely important by avoiding all refined sugars, by eating small portion of food with a lot of vegetables, by avoiding red meat but taking white meat like fish, chicken, turkey, by avoiding saturated fat and oil, but using fat and oil that are less than saturated fat but have polyunsaturated fat and monounsaturated fat like vegetable oil, like olive oil, and the rest. So these are important dietary changes that a person living with diabetes should take. The second thing is that a diabetes patient should exercise regularly. We're going to do a video on exercise later on. Exercise is very important for a person living with diabetes. It has numerous advantages, one of which is lowering blood pressure, lowering blood sugar. It also helps to lower bad cholesterol, especially individuals that have problems with their cholesterol. It also improves sleep and also reduce anxiety. So you can see exercise has numerous advantages. You ask, how will a diabetes patient engage in exercise? You need an exercise of about 150 minutes per week. That is at least 30 minutes in a day and at least 5 times a week. There's several types of exercise that you can do. You can do brisk walk, that means walking fast. You can do jogging, you can do swimming, you can do dancing, you can do cycling, and all other exercises that are available. Apart from exercise, another important thing that a diabetes patient should do daily is taking his medication. Adherence to medication is extremely important. You know, sometimes I know that some of you diabetes patients, you get tired of your medications and you leave it 1 or 2 days, but it's just like someone applying pressure on a spring. Whenever you withdraw that pressure, the spring will go back up again. That means it is the medication that you're taking that is allowing your blood glucose to always be normal. Anytime you withdraw that medication, you will have a lot of issues. So in adhering to the drugs, or whether it's insulin or tablets, it is important to adhere to the dose and also the timing. If you are told to use this medication once, use it once. If you are told to use it twice, please use it twice. So adherence to medication is extremely important. The next thing a diabetes patient must do to ensure he or she lives healthy is checking blood glucose. If possible, every single diabetes patient that can afford should get a glucometer. That means that small machine that tests the blood sugar level. It is extremely important because that's how you'll be able to gauge how your blood glucose is going, whether it's normal, it's high, or it's low. Though sometimes there are symptoms associated with low and high, but sometimes I know you get confused whether these symptoms I'm feeling, is it high or low? So, but if you have glucometer, you can confirm that. So for people that have type 1 diabetes that are on insulin, they may need to check their blood glucose more regularly or many times in a day. However, for people that have type 2 diabetes and have good control, they may just need to check their blood glucose maybe once or twice a week. But there are situations in which you have to check your blood glucose. If you feel the symptoms of high blood sugar, like if you feel you're passing urine excessively, you're feeling excessive thirst, you're becoming weak, it may suggest that the blood glucose is high. That means you need to check it. or if you're feeling palpitations, sweating excessively, having shaking, your body is shaking, it may mean that the blood glucose is low and you need to check and take measure. So checking blood glucose is very, very important. Another important thing that a diabetes patient should do if he or she is to remain healthy is getting enough sleep. Getting enough sleep is very, very important, because if a diabetes patient does not have enough sleep, he will have high level of a hormone we call cortisol. And cortisol counteracts the function of insulin. So if your insulin is not working properly, your blood glucose will go high. Apart from that, lack of adequate sleep would elevate blood pressure. And you know that people with diabetes are at risk of having hypertension. So if you have hypertension or you are just diabetic, if you are not getting adequate sleep, you are at risk of having high blood pressure. Or if you're hypertensive, your blood pressure going up. So it is important that a diabetes patient get enough sleep. For an adult, you need a minimum of 6 hours of sleep, but ideally 8 hours of sleep. But for the elderly, they don't tend to get enough sleep. If they can get at least 8 hours of sleep, that would be enough. So sleep is very important. Another important thing that a diabetes patient must do to remain healthy is examining his food. The examination of your food is very, very important. As I have done in my previous videos, the risk of food infection and amputation is very high in people that are diabetic. So every morning, a diabetes patient should check his food for any ulcer, any wound, any swelling, and seek for help immediately. Do not play with any problem with your feet. Do not walk barefooted. Do not wear shoes that are tight. Always take care of your feet. Very important. That will allow you not to have the complications of the food that may lead to amputation sometimes. Another important thing that a diabetes patient must do is to remove harmful habits. There are certain habits that diabetes patients have that are harmful. Some of these habits include smoking, not adhering to medication, walking barefooted, and other things. Anything that you think that will not help in your blood glucose is a harmful behavior and you should leave it. Another important thing that a diabetes patient should check your blood pressure. I talked about how a diabetes patient is at risk of hypertension. So it is important that diabetes patient should regularly check his or her blood pressure. If you are hypertensive, please check your blood pressure regularly. And the best time to check your blood pressure is early in the morning when you wake up, not after you have gone around, done a lot of things. At that time, it may not give you the true value. But the best time to check your blood pressure is early in the morning when you wake up. So check your blood pressure regularly. The next important thing that a diabetes patient should do is join a group of people that discuss about diabetes, so that you get the experiences of other people and get encouraged. Some of the groups are like Diabetes Association of Nigeria. So any group that you come across that discuss about diabetes, share information, share experiences, please join them, because that will give you that psychological and emotional support that you need to move forward. The next and the final thing, which is extremely important, is getting the right information. You can see I talk about the right information. So it's not just about getting information, but are you getting the right, accurate information? And this is one of the reasons why I come up with this effort, to ensure that diabetes patients in Nigeria and Africa are getting, wherever they are getting authentic information on how to take care of themselves, so that the burden of how to take care of diabetes will be reduced on their shoulders, that they will have the needed information to take care of themselves so that they will be able to live healthy and live long and live well. So if you have paid attention from the beginning to this time, you realize that there are things that are important for a diabetes patient to do. And these 10 things, if you do them, you are going to minimize the risk of your blood glucose going up and reduce the risk of having any complication. If you like this video, kindly subscribe, like, and share so that everybody that needs this video watch it and benefit from it.